Hello, my name is Daniel Pinkney. This is my medical terminology case study for the Straighterline College, and yeah, let's dive straight in. In my case study, we have a 54-year-old man who has been complaining for the past 3 weeks about worsening dizziness, headaches, and tinnitus in his right ear. He has been reporting struggling keeping his balance and describes his headaches dispersed throughout his head. However, they do not throb. He has denied any pain in his ear, nausea and vomiting, and visual disturbances. He has a past medical history of a classical migraine, including concussions and seasonal rhinitis. He is prescribed somatropin for his migraine and occasionally takes ibuprofen for his headache or muscle pain. The Weber test was louder in his left ear, and the Rhine test was also positive. His auditory testing determined that he had a diminished tone and speech recognition. The MRI with contrast showed a 2 centimeter mass at the internal auditory meters extending into the auditory canal. So that is the overall thing. And now why the demographic is important, and we need to know why he has this. It's important to include demographics because of the risk factors that are related to ACE, rage, and gender. As we age, we are more susceptible to certain diseases, health-related problems, which is also important in analysing the case because it could be different for each demographic. The same goes for race and gender, where women can be more likely to develop certain diseases and are in the process of opposite to men, and vice versa. Different races tend to have a predisposition towards certain health issues due to the ancestral environment. Analysing these factors forces and helps professionals evaluate the individual as a whole rather than delving into the specific problem, and to help personalize the treatment. So the medical terms in this case study, we had rhinitis, which is a swelling and irritation of the membrane with the nasal passages, which can lead to congestion and frequent sneezing. The prefix for this was nothing. We had the root word was Rhine and the suffix was itis. The next word was neurology, which is a branch of medicine that deals with the diagnosis and treatment of disorders of the nervous system. And we had no prefix. The root word was neuro and the suffix was urology. Then we had glioblastoma, a cancerous tumor in the glial cells of the brain, and this word had no prefix. The root word was gylo, and the suffix was blastoma. And the next one, we have the medical abbreviations, which is A/OX3, which is alert orientated to person, place, and time. N/V, which was nausea and vomiting, and the MRI, which is a magnetic resonance imaging. So the difference in differential diagnosis: the right-sided acoustic neuroma is the most likely differential diagnosis at this time due to the findings of the MRI. The Mayo Clinic reports hearing loss and tinnitus on the affected side of the alongside dizziness and loss of balance as the main symptom of this non-malignant tumor. Acoustic neuromas are also able to visualize on the MRI, which was apparent in this case, which you can see here. My references are on the bottom. And then but we need to consider how accurate and precise language impacts patient safety, the clarity of medical documentation, and the prevention of miscommunication or misunderstandings among the healthcare team members. So accurate and precise language in the medical documentation is paramount for patient safety, just due to being able to communicate effectively what is going on. Clarity and effective communication among healthcare teams. It ensures that diagnosis, treatment plans, and medication orders are correctly interpreted and implemented, reducing the risk of errors that could harm patients. Clear language in medical records facilitates understanding of a patient history and treatment plan, promoting continuity of care and reducing the likelihood of misunderstandings among providers. And we also have standardized medical terminology, minimizing miscommunication, enhancing patient safety, and by ensuring everyone involved in the case understands the crucial information consistently. Thank you.